Hi and welcome. I'm trying to learn medicine. Today, cervical spondylitis. And after we've done it, we're going to do standing yoga. And if you participate in the standing yoga, then it's at your risk. Cervical spondylitis, we're talking about diseases here and internal anatomy. Cervical spondylitis. That is a disorder that causes pain in and restricted movement of the neck region of a spinal column. Okay, there's been pain in the cervical spine and also restricted movement. Cervical spondylitis mainly affects those over 40 years. It is something accompanied by a slip disc in the neck. Okay, by cervical spondylitis, there is also a slip disc in the neck. Okay, the spine has this disc and they can slip a bit out. Symptoms: pain in the back of the neck or in the region of a shoulder blade. This is often worse in certain positions, for example, lying in bed with the head raised by several pillows. Pain in the back of the neck or in the region of a shoulder blade. This is often worse in certain positions, for example, lying in bed with the head raised by several pillows. And it is sometimes accompanied by a slip disc in the neck. Pain and restricted movement in the neck region. There may be, and this is no medical advice, I've got to say that. This is no medical advice, we're just treating about it. There may also be pain, tingling and numbness in a finger or hand. Treatment usually gets rid of symptoms within 2 or 3 months. Is that 2 or 3 months? 2 or 3 months. Causes: increasing age causes irreversible degeneration of the joints of the spine. When injury or certain other factors, such as having the head raised too high in bed, can bring on the condition. How's the head raised too high in bed? Have several pillows or whatever. An injury can cause it, some whatever strange position. Causes increase. Yes, we had it. Complications. No, let's recapitulate for a moment. Okay. Some strange movement or lying position can cause that the over time and over the time degenerated joints of the spine who had gotten worse over time get slipped out, or that it has been accompanied by a slip disc, or it is just, I don't know for what now. Whatever can bring on the condition. I don't really get know the cause. And there has been pain in the neck, maybe also tingling and numbness in one hand. It should get better with treatment in 2 or 3 months. Causes, complications. Turning the head or looking up may occasionally slow up the blood supply to the brain, causing dizziness or a brief blackout. First of all, the obvious thing, I don't really know what I should say to that, but the other thing, can it be that some people have now dizziness and brief blackouts because they have cervical spondylitis? Okay, turning the head or looking up may occasionally slow the blood supply to the brain, causing dizziness or brief blackout. Treatment in the home. They write here, take painkillers in recommended doses to relieve the pain. When to consult a doctor. If the pain in the neck or shoulder is not relieved by taking painkillers, if there is any pain, numbness or weakness in the finger or hand, if any temporary dizziness or blackout results from turning the head or looking up, such as when decorating a ceiling. Just an architectural question, is the ceiling completely just the wall at the top? Without any corners? So that's completely without at the top? Okay, if there's tingling in the hand, or if dizziness or blackout, or if it does not get better, then consult the doctor. What the doctor might do: question the patient to discover whether injury or any factor such as a new car or new furniture has caused a change in posture. Okay, but how's now the disorder diagnosed? Just about pain? Imagine what happens with everything else, with dizziness or blackouts. Then just with one or two things and not looking after cervical spondylitis. Who would look after cervical spondylitis? Do people look when people report with dizziness and blackouts for cervical spondylitis? Okay, question the patient to discover whether injury or any factor such as a new car or new furniture has caused a change in posture. After examining the neck and testing reflexes and sensation in the upper arm, arrange x-rays. So the x-rays is looked for, and what is not seen on these x-rays? In many cases, he or she will prescribe pain-relieving drugs for the pain and possibly also arrange for the patient to have physiotherapy. Okay, examining of the neck, but how do we know whether they have to examine the neck? Okay, because there's neck pain. Okay, that makes sense. And then also testing for reflexes and sensations in the upper arm and also an x-ray to look at the bones in the arm. And also in mild cases, then maybe some medicamentation and also maybe physiotherapy. And in more severe cases, prescribe a special close-fitting collar to keep the neck in a fixed position. Okay, a collar to keep the neck stiff. Prevention. Avoid postures that strain the neck and upper back. Avoid postures that strain the neck and upper back. Outlook. About 4/5 of cases clear up permanently. In others, the disorder recurs within 2 years. Why does it not recur? Actually, it has to recur. There was nothing done. Why does it not recur? Even more often. Not permanently. Why does it go away in the first place? And the other thing, what is now seen on the X-ray? Because it can be accompanied by a slip disc, that's what we see. But how do we know that is this no slip? But what is now wrong? Yes, what is wrong? Because we say it is sometimes accompanied by a slip disc in the neck. If it's not a slip disc, what is it then? What is then seen on the X-ray, and how do we know it is cervical spondylitis? Okay, we have got a lot of answers to a lot of things, and that's enough for medicine. So if you were here for medicine, you can go directly to the next part of medicine. And it was no medical advice, just because it was a little bit like that. It sounded a bit maybe like that, but it was no medical advice, it was just reading what it's in there. Now, if you were here for medicine, you can go directly to the next part of medicine. We will do now the standing yoga. If you participate in the standing yoga, when it's very harmless. We're breathing in and let the arms up, we don't leave its weights. And before the arms again down. Again in the arms up. And out the arms down. Again in the arms up. And out, open to the side. Up. And out, open to the other side. Again in the arms up. Out in the arms. Now we've ended the arms up. And lean back the crib in the morning. Draw the shoulder blades together. Get in the arms up. Now the arms down, draw the shoulder blades together. Get in the arms up. Bring the hands together and lean back the read movement. Again into the middle. And out and back. In. And out and lean over to one side. Up across the arms and touch my fingers to each heart. And out, reach in front, out of the back. Get in. Intertwine the fingers the other way around. Breathe in, reach high. Breathe out, reach in front, out of the back. Get in the arms up. And out, bring the arms over the sides down. We're going down. Lower down the arm, breathe in and bend the right leg. Then breathe out and stretch only the left leg. Breathe in and change. And out and stretch the right leg. Breathe in and change. And out and stretch the left leg. In and change. And out and stretch the right leg. Again in. And out, both legs straight. Now we're doing the penguin. Breathe in and lift the right hand up to the sky. And breathe out, bend the left knee and look over the right shoulder to the right hand. Again, the arm down. And out and down. Now breathe in and lift the left arm up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in, arm again down. Out and down. Now we're doing the pelican. Make a hand with space between the feet. Shift away to the heels and breathe in and cover. And out and up again. And again in and down. And out and up. And now take hold on the elbows and gently rock from side to side, which ricochets counter weight. Arms again down, close the feet again. And breathe in, come halfway up, straight back into monkey half lift. And out and down. And in, halfway up. And out and down. Now breathe in, bring your arms again up, the upside swan. Hands together and the arms down. And now, a fly, bring the palms together and the elbows together. Lift the arm up as high as you can do it with moderate effort. Down. And again up. Take it up. Okay, now the cashew. Have the feet standing together. Intertwine the fingers behind the back. Tall up, shoulders back, breathe in. And breathe out, head over to one side. And chin down to the cloak. Breathe again in. And out, pull the hands down to the ground. Okay, in, arms up. Head up. Out on the other side. Breathe again in. And out, chin down to the cloak. And pull the hands down to the ground. Again in, head up. And back down. Now take one arm behind the back. Go to same stance. Tall up, shoulders back. Bring the arm up. And bring the head over to one side. But don't pull. Just bring it. Breathe again in. And out, look up to the hand which is on the head. And release. And we're changing the arm, the other hand behind the back. Lift the other hand up and take the head. And bring it over, down, pull. Breathe again in. And out, look up to the hand at the head. And back. Now we stretch our Venus. Go to sit stance, intertwine the fingers behind the back. Bring them over to one side, tall up, shoulders back, breathe in. And out, bring the head over to the side where the hands are. And then the chin down to the cloak. Breathe in. And out, pull the arm and the shoulder down. Arm and shoulder down. And lift the gaze and turn it over to the other side. Also the hands over to the other side. Breathe in. And out, chin down to the cloak. Pull the arm in and the shoulder down. Again in, lift the gaze and bring the head back in. And now, having the feet centered together, we're breathing in and lifting the arms up, sky hugger. And breathe out, the big, long arms. And out and lean back. Out and the arms down. Breathe in and the arms up. The eagle's wings. And breathe out, down with the arms. Okay. And now we're cactus collecting. It stings in the evening. Breathe in, lift the arms up. Bring the hands to touch and lower the hands down to hearts. And that was for standing yoga. I thank you very much and until next time.